2020 was a year during which the country reckoned with racial injustice. After the killing of George Floyd, calls for police reform came from across the country, including rethinking the role of police in responding to mental health crises. Lilia Luciano introduces us to a crisis response team that's working in partnership with police.
In Eugene, Oregon, when you call 911, you don't always get the police. If it's a mental health crisis, you'll get CAHOOTS. For more than 30 years, CAHOOTS, which stands for Crisis Assistance Helping Out on the Streets, has been serving communities in Central Oregon.
There's a guy on River Road who I think would benefit from having CAHOOTS come visit him.
Responding to a fifth of all 911 calls with unarmed crisis workers and EMTs instead of armed police officers.
We respond in teams of 2 to non-violent and non-criminal crises.
So when people call 911, sometimes calls go to police, sometimes go to CAHOOTS.
Yes. Personally, having lost my father during a police encounter, it matters to me that people feel as though there's an option for them in the public safety system that can support them through what they're going through.
Crisis workers train for at least 500 hours on crisis intervention. For the police officers they partner with, that number is closer to 40.
I have a van full of medical gear and clothes when we have it and snacks. I also can bring folks to a crisis center or somewhere to get a shower, somewhere to sober up for a little while. So I have a really large toolbox. When police show up, they have the hospital and they have the jail.
More than 1,000 people have been shot and killed by police in the last year, according to a Washington Post database. And 1 in 4 of those fatal police shootings involve a person with mental illness, according to the National Alliance on Mental Illness. Angela Kimball runs advocacy there.
People are starting to rethink a police response to mental health crises.
What do you take the concept of defunding police to mean?
We take the concept of defunding police to really be more about investing in community resources that really work to divert people from law enforcement involvement. So we're talking about things like crisis hotlines, mobile crisis response.
CAHOOTS saves the communities it serves an estimated $22.5 million annually. And local police say they welcome the efforts now more than ever.
I think the pandemic has caused a lot of anxiety in the community and a lot of the unknowns. And people who maybe initially didn't have glaring mental health issues, those issues started to rise to the top in the community.
And how do the police officers respond? I mean, do they feel threatened, like their job is at risk?
Just the opposite. What cops want to do is stop crime, catch criminals. If a robbery, assault, burglary occurs, we can respond to that instead of being stuck on a call in which we're dealing with a mental health issue. He
says it lets cops be cops again. There's less burnout, less overtime for the agency, and a safer community. For CBS This Morning, Saturday, Lilia Luciano, Eugene, Oregon.
So many things jump out on that. The hours of training, the need to work in conjunction with each other, and just the idea that you have to rethink how we are responding in communities.
Yeah, the need to just think differently.
Yeah, I remember this came up when I covered Daniel Prude in Rochester because there were concerns about his mental state. He had been at a hospital earlier for that very reason, and now you have cities that are looking more seriously at how you can effectively police those issues. And then you saw in the report, it even saves money.
Right.